We interrupt your scheduled programming with breaking news from ABC4 Utah.
Good morning. Sarah Storm here from ABC News reporting live from Intermountain Medical Center in Wendover, Utah. I'm here with Dr. Key discussing the current status of patients who have been exposed to hydrazine from the recent rocket launch. Can you tell me a little bit more about what's happening here?
Sure, Sarah. So here we are a few days after Wendover's large annual Hellfire rocket launch, and this is one of Wendover's highlights of the summer. So the evening of the event, we had a significantly large amount of patients come into the emergency room, all presenting with really similar symptoms. After noticing all of the common symptoms among the patients in the ER, then we started to get concerned and think, okay, maybe this isn't a coincidence. So we believe that one of the rockets that were launched at the festival released a large amount of hydrazine gas into the atmosphere, which led to a sort of airborne manifestation of this acute toxicity that we're seeing. And just in addition to that, some of the participants that were at the event recalled smelling a really strong aroma similar to ammonia, and that's how we kind of came up with our hypothesis of what's going on.
Okay. How many individuals have been affected to date?
So at this point, we currently have about 3,350 confirmed cases, along with a death total of 100.
Okay. What are some of the common symptoms that patients are presenting with?
So the initial and main symptom that patients are presenting with is shortness of breath and a severe difficulty breathing. Some other common symptoms that we're seeing are tremors and seizures in patients that don't normally have these behaviors. Along with that, patients have been coming in with vomiting, very low blood sugar, and severe liver damage. But in addition to all of this, one of the most serious symptoms that we're seeing is the presence of a coma.
So we understand that you're working with your healthcare team to treat patients. Do you have any other help taking care of this issue?
So thankfully we do. So we have help from the Center for Disease Control and Prevention, along with the World Health Organization, the Red Cross is helping out, FEMA, and then we also have our local health organizations that are really on board as well.
According to the CDC, the proper way to treat hydrazine exposure from inhalation is to provide respiratory support. What other tactics are being employed to help the individuals who have been exposed?
So our main focus point is treating the initial symptoms as they present, but really we want to prevent the progression into the coma for those patients that are coming in with symptoms to begin with. But thankfully, our helpful counterparts are working very diligently and hard to find optimal treatment, and we will update the public as soon as we can to give you guys some more information.
Thank you, Dr. Key, for your time. And now I will hand it back to my colleague, Alexandra, who will review the footage from the recent rocket launch.
Hello, Alexandra here reporting on the rocket launch that occurred yesterday at Hellfire Rocket Launch here in Wendover, Utah. As you can see, the rocket flew into the air as hydrazine was spread airborne over the mass crowds that had come to enjoy the festival. Unfortunately, they were not prepared for the hydrazine to spread and cause a neurotoxic effect. Residents of the small city have been flooding Intermountain Medical Center with complaints of neurotoxic symptoms. Patients have been having seizures, difficulty breathing, and so far we have 28 fatalities just 24 hours post-exposure. If you believe you have been exposed or have any of these symptoms, go directly to your doctor.
Thank you, Alexandra. I'm here at Wendover High School with Allison Wright, a representative of the emergency response team assigned to this emergency. Allison, what can you tell us about what you're going to do to resolve the problem?
Hi, Sarah. I'm here at the high school organizing efforts with the police chief, the fire marshal, along with the WHO, FEMA, CDC, and several state volunteers who were not at the launch and exposed. We have set up a point of dispensing here at the high school where we have several treatment stations inside the gym and outside in the parking lot for those who are or could be affected by the hydrazine tragedy.
That sounds great, Allison. What can we expect when the civilians arrive here at the school?
When you arrive here in your vehicle, the attendant in the parking lot will show you where to park so that there's no confusion and ask you to confirm that you are here for the point of dispensing or the pod. Then you can make your way through the front door and someone will be with you shortly to ask you just a few questions in order to decide where you need to go for further treatment or for prophylaxis treatment. Everyone that comes to the high school will be offered education on how to avoid hydrazine toxicity during their day-to-day activities. We'll be here for 24 hours a day for those who need assistance, but we'll be packing up on Tuesday afternoon. Anyone that needs assistance after that should refer to their primary care physician.
That's great to know. Thank you so much, Allison.
Thank you, Sarah.
And now we'll be going to an exclusive interview with the governor to discuss this neurotoxin outbreak. Sarah Storm here at Wendover High School with Governor Shelton. Governor, please describe your plan of action to decrease the rate of exposure.
Okay. So as governor, we all know that disaster preparedness is a joint effort between the state and the local partners, the American people, and the federal government. We shall start off by quarantining the individuals who are exposed to this particular disaster and start treating them with medications immediately so symptoms do not exacerbate. Thank you to all the workers at the POD Center for providing optimal care to the victims. And
What is the current status of the situation?
so currently we have 3,350 victims who are affected by this disaster. We are currently waiting on the CDC, the Red Cross, as well as FEMA for more assistance. We are in dire need of supplies to help maintain the conditions of the patients. This is not something that we prepare for regularly, so any help is greatly appreciated. We are accepting donations at the POD Center as well as the hospital, so please stop by and give back. We are accepting basic essentials such as soap, bottled water, and of course monetary donations are accepted as well. Thank you.
Thank you, Governor, for your time.